How to prescribe oxygen using the different devices and oxygen flow rates that are available. This section will describe how to correct hypoxemia more effectively by using different devices and oxygen flow rates, and it will give you an approximate indication of the different concentrations of oxygen that they provide. This percentage concentration of oxygen given to patients is called the fraction of inspired oxygen, or FiO2. We have so far mentioned that room air contains 21% of oxygen, so the FiO2 is 21%. Although the concentrations given are only approximate, you will see that if you have a pulse oximeter, you can titrate the oxygen therapy to the patient's needs by changing devices or changing oxygen flow rates depending on the patient's oxygen saturation. In the appendix, you will find a useful summary of the inspired oxygen concentrations provided by the different flow rates and devices that are shown throughout the following section. This can be printed in poster or simply as a table and will be needed by staff so that they can document the approximate amount of oxygen being given to the patient. When oxygen is used at low flow rates, for example less than 4 litres per minute, through nasal prongs or face masks, humidification is not necessary. And it's important to note the major safety concerns of water humidifiers due to bacterial contamination. The picture here is of a heavily contaminated bubble humidifier which was found in use on a children's ward. The green discoloration was caused by heavy bacterial growth. Nasal prongs. These are also known as nasal cannula and consist of 2 short plastic tubes that are designed to lie just within the nostrils. They should not be confused with a nasal catheter, which rests much further back within the nasopharynx. Nasal catheters will not be discussed further in this video. Nasal prongs are the most widely available oxygen delivery device. They are cheap and often well tolerated by patients who are still able to talk, eat and drink while receiving oxygen therapy. But they do not permit high flow rates of oxygen, so are only efficient for the management of mild hypoxemia. With oxygen flows of between 2 and 4 litres per minute, they will deliver an inspired oxygen concentration of around 30% to 40%. Higher flow rates than 4 litres per minute are not tolerated by patients. Simple masks at low oxygen flow rates. At these same oxygen flow rates of between 2 and 4 litres per minute, a simple oxygen mask will only deliver a similar inspired oxygen concentration of only 30 to 40%. The reason for this low concentration is because during inspiration, air is drawn in through the edges or holes within the mask to meet the patient's peak inspiratory flow rate. Exactly how much room air mixes with the oxygen is dependent on the individual patient's pattern, rate and depth of breathing, and so we say that all these devices have a variable performance, and all of the estimates of inspired oxygen given throughout this section are only approximate. Simple face masks with high oxygen flow rates. If oxygen is delivered at moderately high flow rates of between 3 and 6 litres per minute through the same simple face mask, then the inspired oxygen concentration may reach 30% to 50%. As with these higher flows of oxygen, less air is drawn in to meet the patient's peak inspiratory flow rate. Unfortunately, at high flow rates, these simple masks waste a lot of the oxygen because during the pauses before and after inspiration, as well as during expiration, oxygen is not stored, and so as it escapes from the mask, it cannot contribute to the patient's peak inspiratory flow rate during the next intake of breath. Disposable face mask with oxygen reservoir. These devices are also known as disposable non-rebreathing masks or 100% masks. They use a reservoir bag to store some of that oxygen that would otherwise be wasted during the pauses before and after inspiration, as well as during expiration. In the example shown here, small valves prevent air being drawn in during inspiration, and they allow the reservoir bag to empty and add to the delivery of oxygen during inspiration. During expiration, the small valves allow expired air, which contains carbon dioxide, to escape and not to enter the reservoir bag. Such features are important to reduce the risk of the patient rebreathing their carbon dioxide. Rebreathing of carbon dioxide could also occur if the oxygen supply fails, for example if a cylinder runs out. With this same oxygen flow of 3 to 6 litres per minute that was described previously with the simple oxygen mask, these devices can offer a higher inspired oxygen of 50 to 75%. If this type of mask is to be effective in supplementing the inspired oxygen, then the reservoir bag must be seen to be emptying slightly during inspiration. This can depend on how well the mask fits onto the patient, so staff must ensure these masks are carefully adjusted to fit the patient's face as closely as possible. Non-rebreathing masks at higher flow rates. If the same disposable face mask with an oxygen reservoir is now used with a higher oxygen flow rate of between 5 and 9 litres per minute, then the inspired oxygen concentration may reach between 65 and 90%. If where you work your oxygen supplies are unlimited, then guidance may be followed that advises even higher flow rates of oxygen of 10 to 15 litres per minute to achieve an inspired concentration of nearly 100%. But note, in situations where oxygen supplies are limited, these very high flow rates of oxygen will be costly for such a marginal increase in inspired oxygen concentration. However, this may still be justified for short periods during severe, life-threatening emergencies. Compliance. Some patients will not tolerate oxygen masks well and may complain of a sense of claustrophobia or a dry throat. If the patient is restless or confused, they may need very close supervision and assistance to help them tolerate oxygen therapy. When giving oxygen to children, education of the parents about the need for oxygen is important to give them confidence in the treatment. If the patient is being isolated due to infection control considerations, there may be even less compliance once staff leave the room. To help with compliance, the nursing staff, and in the case of children their parents, must be closely involved in the prescribing of oxygen. Parents may have previously witnessed oxygen being given only to children who are unconscious or moribund and may need further reassurance. You may now understand why anaesthetists use more sophisticated equipment with valves, tubing and reservoir bags that ensure that a patient is breathing 100% oxygen before or during certain procedures. When using face masks for children, always use the correct paediatric-sized face mask and maintain relatively high oxygen flow rates to prevent them from rebreathing their exhaled carbon dioxide. Only nasal prongs will safely allow much lower oxygen flow rates. This safety point, to prevent rebreathing of carbon dioxide, is explained in more detail in the appendix. In summary, we have looked at a range of simple devices and oxygen flow rates that can be used to deliver an increasing concentration of inspired oxygen. Compliance with therapy is essential if oxygenation is to be effective and needs the close involvement of patients, staff, and parents of children. Oxygen systems, including pulse oximetry, are needed in all areas where seriously ill patients are managed, including medical, surgical, paediatric and obstetric wards, as well as in operating theatres and emergency departments.